109,000. That is the estimated number of overdoses in the year 2022. As it currently stands, addiction is largely becoming one of the greatest risks to the average American. And as such, the United States, as well as local communities, are gripped by fear, a lack of understanding, not quite sure what to do about this issue. As such, there's been a frantic search as to what means or methods can be done to save friends and family from this terrible thing. One such method which has been seen to have some degree of success is that of harm reduction. And while it's not one set pathway or guideline of methods, it can be understood as something greater, as a school of thought to be said. So what is that of harm reduction? Well, to best understand that, you need to consider the historical and social context. See, harm reduction is not a new thing to be had. In the 1980s, with the height of the spread of HIV and the fear of AIDS, Washington State had decided to implement a needle trade-in program. Jay Harless, in a 2017 paper, best culminated this information when discussing its successes, the approaches that were taken, and why it would inevitably fail. And such methods were that because of political and social pressure during the Reagan administration, as while trading in needles was seen as a humanitarian endeavor when it was providing access to people, there were public fears that it would encourage or endorse drug use. So, with that being said, unfortunately, these programs would be defunded. So, again, what is harm reduction? It's not one set thing. It's just an access to treatment, to care, to supplies, to just other individuals that you may speak to on this matter. Irwin, in a 2017 paper, when creating a potential program to be implemented in Baltimore, had seen harm reduction as not necessarily a needle trade program, but a means of disposing used needles, a safe environment to use heroin and to have it tested for fentanyl, and a space in which social workers and nurses who are medically trained may be able to help those who suffer from overdoses. And with the projected $25 million in spending and a potential $5 million a year worth of social programs which could save money from each individual who would normally have died from overdoses, it was seen as something which should be implemented on a community-wide level, if not a national level. But harm reduction is not just something to be treated with addiction. The Canadian Pediatric Society, in a 2008 paper, had concluded that while harm reduction in the United States was rudimentary and this belief system was still in its infancy, it's something which can be implemented alongside far greater scopes. Dealing with teenage pregnancies, in fact, was one such method in which you may be able to implement harm reduction by providing sex education, condoms, other forms of birth control, or even prenatal care. You may be able to reduce these numbers by just providing the means of support. So, with that all being said, it's important to keep in mind harm reduction is not just a belief system. Earlier I'd said 109,000 people had died, and that's a number that most people cannot comprehend. And that's something that really needs to be considered when talking about this. There was an interview I'd found from Soft White Underbelly just last year of somebody just about my age, and she was a college student. Unfortunately had to drop out due to addiction. And she cannot see her infant son, nor her husband, who is also pre-exposed to addiction. She will be living on the streets for the foreseeable future. She cannot stop her fight against heroin, and she is losing this battle. And one large reason because of this is a lack of support, of access. She has people around her who are suffering, and this is something that they may be able to understand on an individual or a spiritual level even. But unfortunately, they cannot get that support needed to break out of this. which once again allows addiction to break up another family and continue to adding to that number. My name is Damon Palacios. Thank you.